Today we'll talk about moxibustion, moksha, the leaf as such, moxibustion, the uses and how best and where it can be used. Okay,
Okay.
so uh, let us start.
Yeah.
Okay, this as you as and the intention of this today's lecture, to according to me, is I will be delivering this lecture and I will be uploading this on YouTube for everybody. It will be a
Okay.
public lecture later on. It's going to, after little editing, it's going to be a public lecture so that more and more people all over the world let them understand how I teach and what motivation is and how it
Okay.
is effectively. Okay.
Great.
Yeah. So let us start. So
Yeah.
moxibustion, all my students who have learned acupuncture from me, they all know and they are very clear about one thing, that moxibustion, inserting needles or cupping or magnets or whatever, all these are the tools. They are the tools to make the chi move. The
Even
chi
magnets. Even
magnet,
magnets, you say?
magnets also.
It works as well with magnets. I was not aware about this.
Yeah, yeah. So all these things you must what I'll say, all these things, all these are the tools. So it is for all my students, is not important that what you are using. It's important to know where you are using it and how the chi inside the body, the soul energy, the life energy that's there inside the body, how that moves and how you can make it to move. And moksha or moksha is one of the greatest boons for acupuncturists to get the results. It's one of the wonderful boons, a wonderful method of treatment. Okay, this moxibustion or moksha, it generally comes in, you can see it comes in box like this, and this box contains 10 mokshas, 10 moksha or moksha rolls of this type. It is, I'll show you later, I'll show you the what are the things I'll show you right now. What are the things available on Amazon?
Yeah.
These are the things you can see. These are the various options. It's of course it's in India, but these are the various options available in India. You can see these moksha rules, moksha sticks. These
There
moksha
are
sticks,
many.
you can see these. They are, they have a different colors.
Hmm.
What is done? Okay, so let me stop sharing. Okay. Now this moksha, what is moksha first of all? Let us understand what is this moksha is. Moxibustion. It's you can call, it's called as mugwort plant. It's a plant, mugwort plant. All this information can be easily seen on internet when you type moxibustion or moksha or something. So I'm not going to go into the details of it. I'll be going more on the practical aspect of this moxibustion treatment. But to better to know that this moksha, this contains leaves of the plant. This contains the leaves of the plants, and if you can see this better, if I open this little, you can see it.
Mm-hmm.
You can see the wool filled inside. This is
Yeah.
called as moksha wool. Moksha wool. The moksha wool is a part of the plant which is the, it's a, it grows a hairy, the hairy structure grows below the leaves. It's like cotton, or it's something of that type, very soft, and that grows below the cotton, and that part is used for treatment.
Okay.
There are types of mokshas, means there are manufacturers who use the whole leaves or other things also. But the wool that grows in under the leaves, it's like a hairy leaves, hairy structure, that gives a better result.
Okay.
Okay. So the best, how to understand the best quality of moksha. Generally, it is whatever I come across. This moksha stick has the wool is filled inside, and it's rolled with a very thin paper. It's rolled with a very thin paper, and it's rolled like a cigar, or it's rolled like a cigarette. Okay. The
Okay.
cover, you can see now this cover as white cover.
Uh-huh.
There are three types of mokshas available. You must have seen in whatever I shown in Amazon.
Okay.
The cover is, at times the cover is yellow. The cover is blue. Sorry, not yellow, blue or green and white. The white is the best moksha. The
Okay.
cover, the stick with the white cover is generally the best quality moksha. Of course,
Okay.
you'll have to find how to, because when you go and, in India at least, when you go and buy it from a shop who sells these acupressure gadgets, you can open the box and see what it is. But perhaps
Yeah.
from Amazon, it may not be that easy, but you'll have to just do a research when they show the images. Okay. Now this moksha grows in Europe, India, or Asia and China. So it's like a wild plant. It's not a very great
Okay.
something very fascinating or something very great. It's not like broccoli or something. It's a wild plant like, but it has a tremendous medicinal value. And it is
Okay.
said in Chinese acupuncture, it is said first treatment for anything, the first treatment is putting needles, piercing needles. That's the first way. Second is moxibustion. The second
Okay.
second option will be moxibustion, and the third anything you want to do. All other things are
Okay.
same. So best is acupuncture because the needle goes deep inside, little inside, not very deep inside, but
Yeah.
little inside, and that activates the chi directly.
Okay.
When we are using moksha, how the moksha is used, I'll show later the practical by lighting this moksha and how to do. But when this moksha is lit by a matchstick, where is that matchstick? Yeah, I have. When the moksha is lit with the matchsticks, it has a fire at the tip. It's exactly like a cigar. It's exactly like a
Mm.
cigar, and from a little distance, you give heat to the particular point. You give
Okay.
one gives heat to the particular point. Okay. In moxibustion, there are many methods of moxibustion. Methods of moxibustion in the sense there is one method which is called as sparrow pecking. Sparrow
Mm-hmm.
pecking. As the sparrow comes and picks up the grains from the floor.
Yeah.
Same way, the moxibustion with this stick, moksha, you take moksha stick, the fire near to the skin and take away. You just go near to
Okay.
the skin and take away. So it's intermittently giving the heat. Intermittently giving the heat. That is one. This
Okay.
is called as sparrow pecking. This is called as sparrow pecking. Generally, I use this method. Only
Okay.
thing during using this sparrow pecking, you must know how the heat, how much heat is the transferring,
Mm-hmm.
because every person who is receiving this moksha, the heat has a different threshold for heat.
Here.
So everybody has a different skin, the sensitivity is different. So I always recommend all my students that before giving treatment to anybody, at least for the first time or first couple of times, at least you must check it on yourself how much time it takes to give heat to the skin. And then when you heat at a particular point, immediately you should touch it with your finger and sense how it is heated. So you can keep adjusting the time, how much it should be given at a time. Okay.
Okay.
Yeah. So this is one of the things which is very important. Giving moksha, you can use moxibustion, moksha treatment anywhere on every point of the body. There is except I say except the upper part of the face one should not use, because eyes are very delicate to heat. The brain
Clear.
also doesn't like heat. It's very delicate with respect to heat. But below the nose you can use it safely. Of course, when you're using it safely, you must use the common sense and not to burn somebody. That's most
Clear.
okay. So this is called as sparrow pecking, taking it near. How much time the moksha treatment, the moxibustion is to be done, depends upon the patient and depends upon the therapist. It cannot be said that you should do for 1 minute or 10 minutes or 15 minutes. It will vary with the patient, with his disorders, and with how many points anybody is using at that time. Okay.
Okay.
Then it comes to where not to use moksha. Moksha, I always tell, moxibustion should not be used for the patients who don't have a skin sensation, who have
Here, it's
numbness,
dangerous.
who have numbness of skin because the heat. I have done by mistake once upon a time. I had done this unknowingly, and the
Oh,
person
wow.
had a blister. He was a paralytic patient and didn't have sensation. I kept on giving heat with the idea in mind that he should recover very fast, but it happened some other way. So from then,
Okay.
I always first thing I ask whether he has a sensation, and if there
Here.
is sensation, then only you can do, and do it with a caution, of course, always. Okay. Now the second type, the other type of moxibustion, the method of moxibustion is called as scarring moxibustion. Scarring. You literally touch moksha, the fire of the moksha touch to the skin and let the skin burn there.
Wow.
What's going to happen? This going to happen is there's going to be a blister. There is going to be a blister, but that's the treatment. Moxibustion, scarring moxibustion. It is used in at certain times, not necessary to use it always, but I have used. I have used. You know. We have done that point GB39, which is for
Yeah.
bone marrow. Bone.
Yeah.
I had used this scarring moxibustion for GB39. I literally
Okay.
put the moksha stick, the fire there, and kept it for a while, and that mark is still there on my leg, still there on my back. But I don't know what happened at that time or whether it has happened. But my hemoglobin is always above 15.
Okay.
My hemoglobin is always, because it works on production of GB39, works on bone marrow, which is producing blood. So perhaps that
Okay.
may be a reason. So at times, of course, I always tell to my students, at times you want to do anything, experiment, you do it first on yourself.
For your know yourself, clear.
Don't burn the patient first. Burn yourself first. See how you feel, what results you get, and then you can do. So
That's
this is a
right.
scarring vaccination. You can do anywhere on the body. Again, scarring will, what will happen is it will keep a mark for years. Few years it
Yeah.
may keep the mark. So you must do it with a caution.
I think it also hurts a bit. Hurts. It hurts to the patients.
It
It
hurts, it
hurts.
hurts, it hurts, it hurts. But our one of the points on the leg, on the knee, it's called as extra 31. The point is called as extra 31, which is given in the book. That point is particularly, it is good for taking out the water accumulation or fluid accumulation in the knee. It's on the
Okay.
knee, and the best way to treat for fluid accumulation is to give a scarring moxibustion at that particular point. And I have done
Okay.
it for one of my friends, and he got a wonderful result in a couple of days. Just I did it
Nice.
once, and he got it. Of course, that burns. That burns. That patient gets hurted. Okay, this is the second
Okay.
thing, second type of moxibustion. The third type of moxibustion treatment is called as long snake moxibustion.
Long?
Snake,
Okay.
cobra or snake.
Yeah, yeah, I got it.
Yeah, and this long snake moxibustion is, this is I think this is the one of the things which I have never tried. I've tried almost everything from acupuncture, the methods, but this is the thing which I have never tried because it is very destructive method. It's a destructive
Okay.
method. It is used for the persons who are having ankylosing spondylosis. Ankylosing spondylosis. And
Well,
yes, now time comes when
yeah.
you have to know what is ankylosing spondylosis. Ankylosing spondylosis is a disorder where our vertebral column, the vertebral
Mhm.
back, the vertebral column, it is having 33 vertebrae.
Yeah.
one or the other, and they are not, they are locked in between, but they are free to rotate. They are
Yeah.
free to rotate. So because of their flexibility, we can turn our leg, we can bend down, and we can do a lot of things. But with these people who are the ankylosing spondylosis patients, what happens is these vertebrae, they get start getting a coating above them, and they get jammed. And once
Mm.
they get jammed, they are these people are not able to turn the neck. They can't just
Okay.
and they will have to completely turn around to see what is going back. These patients can't bend down. These patients can't, whatever, there's a lot of restrictions. There comes a lot of
Here.
restrictions. And it is only because the whole vertebral column or a part of vertebral column gets freezed, something like freezed. It gets jammed. It gets jammed. And because this moksha is a heat, it works best for ankylosing spondylosis.
Okay.
Of course, for ankylosing spondylosis, the the suggested treatment, which is a dangerous treatment, is long neck moxibustion, or it is also called as dragon moxibustion. Dragon moxibustion. What is done is the person who is having this problem, he is asked to lay the in this pronated position, in
Yeah.
pronated position with the back up, facing down and back up, and this moksha wool is taken out and sprayed along the vertebral column,
And
sprayed
then get.
along the vertebral column and lit by matchstick.
Wow.
Naturally, I've never seen anybody doing this, but when you burn this, so you will have to have 3, 4 persons to hold the patient in and in
Please.
position, in position. But according to my teacher, my great teacher, Dr. Lohiya, he has
Hmm.
he had done it, and I have seen the photographs. The people respond to this treatment in single sitting,
Wow.
but it's a very risky treatment, you can say,
Yeah, I understand.
dangerous treatment. So I have never done this. But
You.
using moxibustion, not scarring, just sparrow pecking or distance, giving moxibustion at the vertebral column from a distance also gives equally wonderful result.
Okay.
Okay, this moxibustion is a boon when we are going out of station, when we are going for outing, when we are going on vacations, and many a times on vacations, when somebody comes across some mishaps, the twisted ankle or the pain or something of this type, then the moksha is of help. Generally, moksha heating or the treatment with moksha, wherever there is a pain, you can use moksha. You can use
Okay.
it moxibustion wherever there is a pain. Of course, as I said, without
Yeah.
about the head, anything else. Where you should not use moxibustion is where there are varicose veins on the legs. The legs,
Varicose leg,
varicose veins.
varicose veins.
Yeah, varicose veins are the prominent veins. They protrude out of the skin, and they look bluish and greenish.
Yeah.
So directly giving heat onto those veins, which are already weak, will cause
Mm.
a problem. It will cause,
Okay.
it will make the condition serious. So for giving moxibustion on the legs, you have to see that you are not anywhere near to the varicose veins.
Veins. Okay.
Otherwise, you can do moxibustion anywhere, everywhere, and almost practically every point on the body can be treated with moxibustion with equal great results.
Wow.
Okay, but the best part of the moxibustion is to control the dysentery.
Ah.
Yeah, we said on the in the last lecture that to control the dysentery with the moxibustion, with 7 points on around the belly, the 7 points around the belly. I'm going to show you how it is with the
Yeah.
lighted. So these 7 points around the belly, they will be wonders. And to my experience in last 20 years, the dysentery or the problem with digestion generally stops within half an hour. The dysentery is controlled within half an hour. The same points can be used for constipation also, but the dysentery is always acute, very recent. Dysentery,
Mm.
generally, the dysentery is not for years together. Very few
Yeah.
people may be having, but the constipation is generally chronic. So constipation with the same points, constipation also gives results, but it takes little more time. You cannot expect a miracle of happening something in half an hour. But
Okay.
if somebody has a constipation, like he has not passed on the stools in just a one day, it's only one day, and then you give treatment, he will get a relief from that.
Okay.
Okay, so this is about moxibustion. There is one more problem which is generally it comes to many people have this problem of calcaneal spur. You know, calcaneal spur. It's a pain in the heel,
Mm.
pain,
Okay. Ah,
pain,
yeah, 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 yeah.
pain in the heel, pain in the heel.
Yeah,
And
yeah, yeah, yeah.
people come, my patients or the people come to me for calcaneal spur or heel pain, and I don't give them any treatment.
Mm.
I show them this moxibustion treatment. I forward my video on moxibustion to them and give them this stick, and I tell them go at home and do it before going to bed. Tomorrow morning you will
Okay.
get the result. Generally, most of the people get a wonderful result at their home without spending any money, without spending any
Oh,
money or giving anything to the therapist. And
yeah.
that, where to take the treatment? Wherever there is a pain. On the
Okay.
heel, wherever there is a pain, the moksha can give a result.
Work.
Most of the people get a result, and many a times it happens that my patient takes away one or two, a couple of sticks of moksha, and then when he gets the result, he takes a full box of 10. He takes because those two sticks are taken by somebody else, some neighbor or some friend, and
Clear, of course.
he doesn't have anything for himself. So he comes with a box. Anybody takes because it's not very costly. It's not quite
Again.
cheap. It's quite cheap, but the results are amazing results.
Okay,
Okay.
nice.
So and you can okay. How many times this moxibustion treatment can be taken? It's exactly like the way I tell about acupuncture treatment. You can take this moxibustion treatment if you have time. You can take it 3 times a day. You can take it twice a day. It depends upon how you feel. If you are better,
Okay.
if you are getting the result and better with a single sitting, with a single treatment in a day, that's good enough. You don't have to take it thrice.
Okay.
But if you want to have more of treatment, you can take it thrice. Once in the morning, once in the afternoon, the third time at before going to bed.
Okay.
Okay. There are many variations done by the people about this moxibustion. What they say, but they are little not that easy to use. And I am a very lazy person. I'm very lazy. I don't like to make the things complicated. I always like to make the things simple. So
Okay.
what it is suggested, you know, ginger, you know,
Ah, yeah.
ginger, it's
Yeah, yeah.
yeah, the ginger, it's a rhizome. It's a rhizome which grows under the soil. So what ginger itself has a healing properties, lot of healing
Mhm.
properties.
Yeah.
So what is done by the people is the ginger is sliced, a thin slice, and that thin slice of ginger is kept on the painful part or wherever you want to give a treatment, and
Uh-huh.
this and give a moksha hit to the ginger slice. So with the chemicals in ginger, with the material in ginger and moksha hit, it gives a better result.
Okay. So fresh, you mean fresh?
Fresh ginger, fresh
Okay,
ginger.
okay, okay, okay.
Yeah, fresh ginger. A slice of,
Nice. And
but I prefer. But now this becomes little difficult to handle everything.
mhm.
Taking a slice, putting it there, and then everything.
Yeah.
I better suggest for this is take the juice of the ginger with the fresh ginger, you squeeze it in a crusher or something, take the juice apply the juice at wherever it's required, and then give mixture, because then it
Much
becomes very easy to use.
here.
Okay. This moksha, okay. As I said about this dysentery, which I'm going to show the points on my body itself.
Yeah.
But this moksha works wonders with ST36. ST36,
ST36.
Susan Lee, and that's the great. It gives a great help to those who have indigestion problem. Anything in indigestion or the bloating of the because of excess eating, there is a bloating of the stomach. Then ST36, this moxibustion on ST36 is a wonderful treatment.
So anyway, for problem related to the stomach, you mean?
Yeah, stomach.
Okay.
Yeah. Okay.
Okay.
So this is about most of the things which I know about moksha. And there are
Well,
this moksha. Okay, this moksha comes this way. This has a very strong odor. This
mm.
has a very strong odor, and many a times it resembles to some narcotics.
Oh, really? So
Narcotics.
you have to be careful.
So you have to. No, it's not. It's because I have given this moksha boxes to the people going to US from India,
Hmm.
and they were not caught anywhere. So it is not a narcotic.
Okay.
So the dogs or the care, they who are trained, they know what is that this that.
Okay. Okay. Okay.
But that smells reminds somebody of that
Mm.
type of smell. But there are people I know who go into deep meditation just with the smell of this. They
Uh-huh.
go to a different level. They go to a different level somehow.
Wow.
Some people like this smell very much, and some people simply hate it. It's because it's
Okay.
very strong. Because it's very strong.
Okay.
Yeah. So
Can you turn it up with a lighter or just with matchsticks?
it can you can light it with a lighter. You can light it with a matchstick.
Oh, okay.
You
Okay.
can light it on a gas stove at home.
Okay. Okay. Okay.
If you are at home, you can light it with a gas
Okay. Okay.
stove.
Okay.
Yeah, it's any way you can light it. Any way you can light it. The ash, when you light
Yeah.
it, and when it burns, it's going to emit some ash. It's like a
Here.
cigarette ash. So
Yeah.
you must keep a bowl with
Uh-huh.
you to.
So you can.
It's like an ashtray. It's like an
Yeah.
ashtray
Yeah.
for
Yeah.
moksha. But this ash is again a great medicinal value. The
Oh,
ash
really?
also, yeah, it has also. Suppose if somebody has a indigestion, and I don't know how to put it in English. Because of
Mm.
indigestion, sometimes it smells very bad. The mouth
Mm-hmm.
smells very bad. It's like bitter taste coming into the mouth. Indigestion of the.
Okay.
Then in that case, take a pinch of this ash, put it under your tongue, let it dissolve, and the indigestion subsides within half an hour.
Wow.
So
Okay.
it has everything. Every part of moksha is
It's
everything.
usable.
It's usable. It's usable. So
Okay.
this is about moksha, how to use. Now I'll show you. I'll just see how to put everything.
Okay. Thanks.
So I'll put up the fan because lighting.
Yeah, I
I
understand. This is
don't know
very strong.
how quickly it will get lit, but this is the way. Just a minute. I'll get it lit from my gas stove. I'll get
Okay.
that. That will
Yeah, yeah,
that,
yeah.
that will be easier. Okay, here it is.
Okay. You know it's turned on.
Now you can see,
Yeah, yeah.
and there's a lot of smoke coming out of it.
Yeah.
Some people love the smoke, the flavor. Some people don't like it at all, but it's a wonderful tool. Okay,
What
now
about you? Do you like the smell?
I like the smell, but not so much. Not so much, but I
Okay.
like it.
Okay.
It's not irritating for me, at least I can say.
Okay.
Okay, now when you want to give a treatment, now what I will do, I'll show you. And let me see how. Yeah. So I'm giving this treatment to my Li4 at this.
Li4. Yeah, I was going to tell you.
Taking it to near to it, if you can.
Yeah, I can see. I can see.
Yeah, I can see. Take it near, take it away. Take it near, take it away. Take it near. Heat, yes. When I felt the heat, I take away.
Okay.
When I so with in this way you can treat any point. Suppose has a elbow pain. Wherever there is a pain, you just use.
Okay.
There is a wrist pain. Any problem with the wrist? Anything practically anywhere you can use. You have problem with the throat,
You can
you
use it.
can use it on the chest.
You don't have to specifically put it on a point. Even the area is fine.
Even the area is fine. Better if you go close to the point, that's better.
Of course, it's
You
better.
must
Yeah.
know. You must know. And then now, when it time comes, when you have to ash.
Uh-huh.
So the simple way, the easiest way to for I always tell to the rheumatoid arthritis patients who have the problems with the small
Yeah.
joints and the hands, I give them the moksha stick and ask them to heat the webs
Okay.
on the webs in the webs.
Okay.
So practically you can do it anywhere. You can do it anywhere, wherever you want to. Okay. And now I will show you the points which I will be okay. Now one thing I missed to tell you. One of my online students, when Corona and all those this everything was locked down, in the
Yeah.
course, online course, one of my students used this press needles for his wife, for cervical
Mm-hmm.
spine disease of the wife, and he used moksha on the press needle.
Uh-huh. Okay.
Heating moksha because the needle already inside and you are heating. So same thing can
Oh,
be used with the
clever.
longer needles. Longer needles. It's called as
Clever.
moksha on needle. It's called as moksha on needle.
So that is faster
Yeah, it gives
as
better.
treatment.
It
Better.
gives additional effect. This is many people what they do is put a needle, take out the moksha wool, roll it or press it around the needle on the top of the needle and light it.
Uh-huh.
So
Okay.
it's a moksha on it, but it's the way you want to do. But that makes
Okay.
I think little complicated because it's a burning thing. If it falls on the bed or somewhere, there may be
Yeah, you have to be careful.
danger of fire. So you have to be very careful with all this. Okay.
Okay.
Now I'll show you how to.
Yeah.
This is
So
on the
those are the point for dysentery, right?
dysentery. I'm showing you the point for dysentery.
Yeah.
For three fingers, fortune, two
Yeah.
tunes from this, from navel. Then second point, ST25, SP15 on one side. Again, ST25, SP15 on other side. Then this, the you can see this thing, the tape here.
And
This is rain
REM
12,
12,
rain 12, and just below is rain
REM
6,
6.
the sea of energy. If anybody is tired, if anybody
Mm-hmm.
is tired with the day's work or the work
REM
of
6
the day, then give moksha on rain
on REM
6. He
6.
will recover within 5 minutes. He will recover
Nice.
within five. The instant, this is like giving instant energy.
Wow.
I always say use this moksha at 3 points to boost the energy. What generally after the surgery or after the illnesses, the doctors recommend B complex.
Yeah.
to boost the energy, to give energy. It's like a tonic. They recommend
Yeah.
tonic. But instead of, you can use those tonics, no doubt about it. Means there's nothing saying that you don't have to use it. But using moksha on REN 12 and liver 3 on both the legs, liver 3 on both the legs and REN 3, these points will boost energy like anything.
Ren
This
12?
REN 12, sorry, REN 6.
Ah, Ren
REN
6,
6, REN
okay.
6, REN 6.
Ren 6, and what other point for the
Liver 3,
energy?
liver
Ah,
3,
liver 3.
liver 3.
Okay.
Okay.
Yeah.
And the same way it can be used for the back of the
Uh-huh.
bottom. As I said, that ankylosing spondylosis, the patient with ankylosing
Yeah.
spondylosis or whatever disorders of vertebral column, everything, moksha is good for everything.
Okay.
Moksha. Of only thing with moksha is you must use your common sense, where to
Yeah,
touch,
of
where
course.
not to touch, and where to use and when not to use.
It's anyway something that's
Yeah.
burning,
So,
so you
so
have to be
ultimately,
careful.
when we end, I'll take the position. No, stay.
Yeah, I can see it.
No, no, I wanted to show something. Okay. Now, when you want to, how to end the treatment?
Mm.
Now, this moksha, this is a burning. So before you put it off, it must be put off.
Yeah.
Before you end. So before going to bed, this has to be put off. So what I suggest is take a bowl of water,
Uh-huh.
take a bowl of water, and with this add few drops
Okay, on the burning part.
on the burning part.
So it
But
get okay.
and ensure that it is put off completely. Don't use excess water. It should be you'll understand that when you start using it,
Mm-hmm.
because if there is a fire inside, within
Ah,
within 2 hours it will get completely burnt out.
okay, okay.
So
So
you must
we have to
ensure
be
that it
sure.
goes. It goes. It gets
And then
burnt. And
can you reuse these
yes,
sticks?
yes. Now when this is put off, I have kept it now, and tomorrow morning, if I want to use it again, I will just light it again from the same place.
Okay,
Or,
okay,
or
okay.
if it is for some reason, like in India now there is a monsoon, so the weather is wet. It doesn't get dry fast. So what I will do, I will today I'll use it from this end, put it off,
Okay.
use it from other end tomorrow.
So you give time to
Yes,
dry the other
to
side.
get right. Okay.
I understand.
One of my students, when it comes to the end, when it comes to the end, you can imagine it will be a very small thing. It's
Yeah,
like a
and you
butt
can
of a
burn.
cigarette.
Yeah.
It's like a butt of a cigarette. And one of my students came out with a bright idea that he used a stick, something like a stick, and put a needle inside,
Okay. So you can keep
put a
using
needle
it
inside, and with a stick, with a wooden stick, and a needle inside, and you can use to the end. You don't,
until the end,
you're
right?
not wasting anything. With this, you are not wasting anything.
That's right. That's clever. Yeah.
Yeah. Okay. So this is the what
Motivation.
I moxibustion. But in my clinic, I don't give treatment to of moxibustion to anybody,
Why?
because my clinic is very small, very cozy, and this smells remains there for a long.
Uh,
It remains
okay.
there for long. It
Yep.
and you are
Yep.
using it at home. Suppose you are using it at home. Then
You need to pay a higher rate
yeah,
to be done in the clinic.
yeah. And this
That's
the
right.
whole the when you're using at home also, if you're using it regularly, the curtains and upholstery it starts smelling.
Got
It
it.
gets
Got it.
yeah. But it's worth doing whenever it is required. It's best for any painful condition. Generally, any painful condition, immediately you give moksha treatment, it gets some relief. And there are many of my patients who are better only with moksha. And the best part to my this thing is this for this treatment, you don't have to come to me. You can,
Of
you are
course, you can do
doing
it by
it,
your
you
own.
are doing it on yourself whenever you have time, and it is very easy and cheap. It's not
Yeah,
costly. When you are using it on your own, it's very easy and very costly. So this is
yeah.
the way, just to sum up the lecture about moxibustion. This is the way I teach the acupuncture, making it
Uh-huh.
everything as easy as possible. And
Clear.
it should not be only theoretical, it should be practical and make use of everything that comes to you.
Clear.
So this is
Clear.
moksha, and get it from the Amazon or wherever. Better is it's called as better is the white
Why?
wrapping, with the white wrapping. But anything, whether blue or green, all have almost equal results. White has a little better results, you can
No,
say.
they are the same. You're not. You do not use a
Then,
different
then,
color for
then
different
it's
things.
called as quality. It's called a
It's
little
quality. I mean,
different. White has the best quality, it is said. Okay, one more thing I just forgot to tell, and that is, let me, yes, let me put it aside. Okay, this moksha also comes in smokeless form. Smokeless,
smokeless.
smokeless,
Uh-huh.
smokeless, and that's like that's good for the asthma patients or the patients with
Ah,
breathing disorders, because this smoke will is going to irritate them. Of course,
mm,
it's almost 3 times or 4 times costlier than this. The cost goes up,
okay.
but it is a smokeless moksha. There is available smokeless
Okay.
moksha. There are moksha cones available, small cones, but I prefer using a long stick, because one stick you can use it for a very long, and the handling is easy. With the small
Yeah.
cones, you have to take
It,
care that it doesn't burn, it doesn't fall off,
yeah. Of
it doesn't
course.
put fire at the home, or all the things you have to take
Or
care.
burn yourself as
Yeah,
well.
people, you know about this cupping, cupping, cupping,
Copying.
cupping, negative
Ah,
vacuum,
copying. Yeah. Yeah.
cupping, vacuum cupping.
Yeah.
This
Yeah. Yeah.
this called the cupping is also done with moksha.
And you
Like
you mean
the,
the burn?
it's burnt or it's not burnt. It's the moksha smoke, that the moksha stick that is inserted inside. The air is
Yeah.
burnt and the cup is put. It's called
Ah,
fire
so
moksha. It's called as
yeah,
fire
yes.
moksha.
So
Uh,
so so,
Fire
so
cupping.
cupping is done with moksha as well.
Cupping and moksha together, you can say.
Ah, okay, okay, okay. Because you have to burn the cup in order
You have
to
to
create the
hold the cup.
vacuum.
You hold the cup and put it inside. Put the moksha inside.
Uh-huh.
So, and immediately put the cup wherever you want to.
Yeah, 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 yeah. And it's stuck
So
there.
it's that.
Okay.
Okay. So this is the way. And thank you very much for giving me an opportunity to speak in English, because all my videos, there are 400 videos of mine on YouTube, but all are in Indian languages. And
Hopefully this
yes,
is the one of a long list,
yes,
hopefully.
this is going to be like something like putting me onto the international level. Thank
I
you.
hope so. I
Thank
hope
you
so.
very much.
Thank
Yes.
you too.
Okay, so we'll stop here only with this, and wherever possible or however possible, you get moksha and use it
Yeah.
and see the first-hand result. You have
And
to
I'm,
see
I'm
the
going to
first-hand.
I'm going to buy it today, right now.
Okay.
I just wanted to wait for
Yes.
the lecture first.
Okay. So Hari Om.
Hari Om.
Thank
Hari
you
Om.
very much. Hari Om. Hari
Th-
Om. Yeah.
Thank you.
We'll meet tomorrow or
No,
no?
Monday.
Oh, we'll meet Monday. We'll
It's
meet on
it's
Monday.
Friday today.
Today
It's
is
Friday
Friday.
today.
Today is Friday.
Yeah,
We'll meet on Monday.
on Monday.
Same
Great.
time. Same time.
Should be the last week. I think so.
Yeah, it will be a last week.
Less or more.
Yes, 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 yes. It will be the last week. So,
Okay.
well,
Bye bye.
bye bye.